ahead.
Hi, my name is Cindy Barrus. I'm Program Director for our Subacute Rehabilitation Program that's located on our Kalamazoo Avenue campus, where we are building a new building. And I am so happy today to be showing you our private rooms. So if you want to follow me on in, I'll point out some highlights and tell you some of the secrets behind the scenes. So as we come into the room, we've got nice storage areas here that will be easy for our staff to access. And of the 77 beds that we have on the first floor for the rehabilitation program, 61 of them are private rooms. Come on in and we'll look a little bit further. What I like to say is there was a lot of work, a tremendous amount of work that went into these rooms that you can't see. But something that was a great experience for me and many of the colleagues that I work with is that we got to have a lot of input into these rooms. We made rooms, like set-up rooms that we could try out and go in and offer comments. And we had many staff that came in the evenings and on the weekends, and we started looking at the nuances of what makes for a good room. The other piece of feedback that we had was through our Patient Family Advisory Council. So where do the plugs land? Maybe, like even where does the toilet paper go? When we're working in rehabilitation, if the toilet paper is too far back and the range of motion doesn't allow for that, then we're not helping people be as independent as possible. So behind the scenes on this, there's really a lot of exciting things that we've been able to put in. All of the private rooms have a window, they have their own bathroom, the bathroom has a shower in it, and all of the doors are this new barn type of door. And when I first heard about this, I wondered how that would be for people that maybe don't have as much strength in their arms or maybe don't have a grip that allows them to open and close it. But you can see we've got this nice big handle, and I barely have to push it and it will go. So, you know, when I think about the people we serve, I feel like we've done some very good design things in the room. One of the great things about this program is way before my time, many years ago when we first started working on this campus, the team that was working here decided to use CARF, the Commission on Accreditation of Rehab Facilities, as the kind of like the template or the skeleton for designing the program. And the great thing about CARF is it looks at the unique needs of the people that we serve in this type of environment, and it pushes us as rehabilitation professionals to make sure that we are having a great environment from an architectural perspective, from a space perspective, that supports the people that we're serving. On this campus, we do a lot of work with neurorehabilitation, and so oftentimes people that we're serving really need to have a quieter environment, a way we can reduce the lights so we have dimmers and ways that we can calm things down and can calm sound down. And then we have many private spaces that we can do treatment for so that we are meeting the unique criteria that goes along with being a CARF accredited program. One final word on that is in the United States, there are actually less than 1% of all skilled nursing facilities use CARF as a criteria for rehabilitation, and we are one of those. There are only 6 skilled nursing facilities in the country that are accredited in brain injury, and this is one of them. We have a lot to be proud of in Spectrum Health. Thank you for joining me today.